Edema, which is caused by excessive accumulation of interstitial fluid, is a common clinical sign. How does it form? What factors affect it? Why does the patient with right heart failure have edema in liver, spleen, and lower limbs? Why does the patient after mastectomy have edema in the arm at the affected site? To settle these questions, we will learn the formation and the return of interstitial fluid. Most interstitial fluid is gelatinous and can't flow freely. Therefore, it won't flow to the lower part of the body due to gravity, and it's difficult to be ejected by syringe. The gel matrix is collagen fiber and hyaluronic acid filament. The dispersion of water and solutes isn't hindered. A small part of interstitial fluid near capillary is in solid state and flows freely. Because small molecules can pass the wall freely, the protein cannot. So, the main difference between interstitial fluid and plasma is protein. The formation of interstitial fluid depends on 4 factors. Capillary pressure is the lateral pressure of flowing blood on the wall, squeezing the blood to filter out. Interstitial colloid osmotic pressure is the ability of protein in the interstitial fluid to attract and retain water. Therefore, these 2 factors promote the formation of interstitial fluid. Interstitial hydrostatic pressure is the pressure of interstitial fluid on the capillaries. Plasma colloid osmotic pressure is the force of protein in plasma to attract and retain water. Therefore, these 2 factors promote the interstitial fluid return to capillary. The difference between them is effective filtration pressure. When the pressure is positive, the interstitial fluid is formed. When negative, it returns back. Next, let's look at this picture. According to the formula, it can be calculated that at the arterial end of capillary, the effective filtration pressure is 10 millimeters of mercury. So there's formation of interstitial fluid. At the venous end, the effective filtration pressure is negative 8 millimeters of mercury. So the interstitial fluid returned to the blood. We can find that the force at the arterial end is greater than venous end. Therefore, 90% of interstitial fluid formed at the arterial end returned to the venous end, and remaining 10% entered the lymphatic circulation. At normal, there's a balance between the formation and the retaining, so the amount of interstitial fluid remains constant relatively. If this balance was destroyed, the interstitial fluid formed too much or returned too little, edema would appear. 4 factors affect it. The first is capillary pressure. Obstruction of venous return or arterial expanding can make the capillary pressure rise. The effective filtration pressure increase promote the formation of interstitial fluid. Thus appeared edema. Right heart failure lead to the increased venous pressure. Venous return decreased. blood with detent in capillary, increased capillary pressure, appeared edema in liver, spleen, and lower limbs, while left heart failure accompanied with pulmonary edema. Inflammation can cause local arterial dilation and edema. The second factor is plasma colloid osmotic pressure, which is determined by plasma protein. In malnutrition or liver disease, the production of protein decreased. In kidney disease or burn, the loss of protein increased. In malignant tumor and chronic infection, the consumption of protein increased. All of these lead to the decrease of plasma colloid osmotic pressure, thereby the effective filtration pressure increased and the interstitial fluid increased. The third factor is lymphatic return. About 10% of interstitial fluid need to return through lymphatic system. Therefore, lymphatic return can affect interstitial fluid. At the same time, if interstitial fluid is too much, lymphatic return is strengthened to prevent the accumulation. The edema in one lower limbs, in filariasis, and the swelling arm after mastectomy are all caused by the obstruction of lymphatic return. The fourth factor is permeability of capillary wall. At normal, the capillary wall is almost impermeable to protein. However, in the case of infection, burn, frostbite, allergy, insect bite, and so on, the permeability of capillary wall increased. Plasma protein seep out, so the plasma colloid osmotic pressure decreased, while the interstitial colloid osmotic pressure increased. As a result, interstitial fluid increased and edema appeared. Next, let's do a summary. The formation and return of interstitial fluid are driven by the effective filtration pressure. When the pressure is greater than 0, interstitial fluid forms, while less than 0 returns to the blood. 90% of the fluid formed at the arterial end returned to the blood at the venous end. 10% of return through lymphatic circulation. Edema is a common symptom, which is often caused by the imbalance of capillary exchange. We can find the reason from 4 factors: capillary pressure, plasma colloid osmotic pressure, lymphatic return, and permeability. That's all for this class. Thank you. See you.